Hello, I'm Ira Bedzow, and this is The Good Life, a show that talks about all aspects of human flourishing, from physical and mental health to social and spiritual well-being. I want to thank our sponsors for the show, the Restoring Religious Freedom Project at Emory University School of Law, and Shlomo's Restaurant at the base of Aspen Mountain. The topic of today's show is, what are the values of healthcare delivery? And I will be speaking with James Corbett, who is a Senior Vice President of Community Health Improvement and Values Integration at Centura Health. Before we begin discussing the details of community health improvement and how values are put into practice in a healthcare system, let's break down the issue to give some background and set the stage. There are two major areas of tension in healthcare delivery that affect the debates over where resources should be invested and who should direct the course and goal of medical care. The first area of tension is over whether health is a public or a private good. When seen as a public good, healthcare delivery is about making sure that a group of people, whether that be the country as a whole or different communities in particular, achieve certain levels of good health. Public health organizations and government agencies work together with hospitals and healthcare systems to provide access to care and ensure that people have clean water, clean air, and healthy food so that everyone benefits. Similarly, when considering treatment and prevention options, healthcare systems will consider social and environmental factors that affect health through the methods of population health, which is an approach to healthcare that claims that where and how people live influences the types of illnesses to which they are vulnerable and the treatment strategies that they can pursue. When seen as a private good, healthcare delivery is about treating individuals based on their own personal histories, resources, and life goals. This view sees healthcare as a personal responsibility of individuals who make choices in their lives and live based on those choices. Healthcare systems provide services to individuals when needed and requested. They do not limit the options available to people based on group consensus. The second area of tension, which is separate but related, is over which values should healthcare adopt and who should choose those values. One view is that the medical profession, as a profession, is a calling with a set of goals and values that should guide this conversation. Of course, the beliefs and desires of patients and families should be considered, yet the idea that medical professionals, by virtue of their role as healers, their training, and their experience, serve as authorities on medical issues. Patients, due to the vulnerabilities inherent in being sick, are dependent on physicians and other healthcare providers for their care. Medical professionals, therefore, should play a much larger role in shaping the values of healthcare delivery. The other view is that healthcare is a business, and like any other business, buyers and sellers have an equal role in coming to agreement. Moreover, as a service industry, patients, as consumers, should have a larger role in setting the course of treatment and the role that healthcare plays in the general economy. Whether healthcare is a public or a private good, and how much influence medical professionals and medical consumers have in shaping healthcare, affects every aspect of the debate, from legislative debates over who should pay for healthcare to whether physician aid in dying and medical marijuana should be considered legal or not. Both sides in both of these tensions have sound arguments, and any productive answer would have to incorporate the benefits of opposing views. Yet finding the right balance is so difficult. With this setting of the stage, let's hear how a leader in the field navigates these debates in directing community health improvement and values at Centura Health. James, tell me a little bit about Centura Health. Where is it located, and who are its patients?
Great. So Centura Health is an 18-hospital integrated health system in 2 states, Colorado and Kansas. We have 22,000 employees. We serve over 1 million patients annually, and our patients are a mix of where our hospitals are located, from downtown Denver to rural communities such as Pueblo, Colorado, Durango, and Garden City, Kansas.
With such a diverse population, how do you pick what kind of values come in a rural population or rural health and downtown Denver, we're in a more urban environment?
Yeah. Well, we're a nonprofit health system, so I would argue that as a start, the value that we see is health as a public good. If we weren't a nonprofit institution, we could have a different conversation. But much like museums or education facilities, we get a tax deduction to do the work that we do. So we see that as a public good. So with that in mind, the values that inspire us are values such as justice, values such as empathy, Values such as ensuring that the values and the ideas of those communities we serve are met fully. We start with the needs assessments of the different communities, and as you can imagine, the needs of downtown Denver are vastly different than Garden City, Colorado, Garden City, Kansas. So we'll look at those needs, and then we'll build programs to address the unique needs of those communities.
Mm-hmm. You know, so as a senior vice president of community health and values integration, and I have to ask you what that actually means in practice, what type of job description do you have in managing all of these different hospitals with all of these different needs?
Yeah. Well, I think as a start, it's important to realize that modern health systems are very common and they're very vast in their reach. I mean, I do believe we're in the era of what I call the mega health system. Much like banking industries and others, you have these small community banks that are now part of larger institutions. The same is happening with healthcare. So roles such as senior vice presidents become very much more important as you navigate massive amounts of doctors and business in different states and different institutions. My particular role, I'm one of 6 senior vice presidents at Centura. My particular role includes the community health programs, behavioral health, global health, and we have global health in Rwanda, Tanzania, Haiti, Peru, Nepal, and Cuba. I'm also in charge of our research operations and our ethics and spiritual care.
Mm-hmm. So, you know, you mentioned mega health, and in one respect, it kind of scares me because when compared to a banking industry or these other major industries, I feel that there might be the chance to be lost as an individual. I mean, there's one thing to be a consumer at a bank where I know that, you know, as long as you do a good job and keep my money, I'm happy.
Uh-huh.
But as a patient, I get very nervous in hearing that health is mega or big business, but also this whole idea of population health. Where does the individual come in?
Yeah. I guess inherent in your question is a kind of belief that maybe larger is not necessarily better, right? Mm-hmm. And I think that if you think of modern healthcare and the learnings that we are having consistently, there is a way in which putting large groups of institutions together means there's opportunity for shared learnings. Mm-hmm. At the same time, there's opportunity for shared savings in supply chains and other areas where you can buy as groups. But you did hit on an issue. I mean, there is this notion of big business. And, you know, we're not making widgets in healthcare. So Milton Friedman has a quote. His quote is, there's only one social responsibility of business, and that is to make profit without deception or fraud. And you can understand how it would be a little problematic when you're talking about human beings. Fortunately, we're a value-driven organization. I'm a senior vice president with value in my title. And the goal for us is to make sure that the values on our wall live out in reality in our institutions, in the treatment of our patients, in the treatment of our employees. Our values are called, CRISI is the acronym, compassion, respect, integrity, spirituality, stewardship, imagination, and excellence. And we take those values and we do leadership-styled TED Talks with them. We call them CRISI Talks, where myself, other presidents of the hospitals, and other senior vice presidents go in front of a crowd, and we talk about a personal connection with the value and how it inspires our leadership. That's just one way we try to make those values in action.
Now, first, I think that's great, and I think that really looks at how the healthcare system and Centura's healthcare system has a culture that incorporates those values for all the professionals that work there. How is that message then transmitted to the patients so that they're aware of the values and how those values are integrated through Centura Health?
Right, yeah, it's a really great question. So I always like to look at these issues, particularly with large institutions, is what are structural solutions and then what are individual solutions, the provider patient solution. So let's start structurally. Structurally, when we make large decisions about service lines or expansion, we look at all the business objectives, obviously, but then when we do what we call a VIA, or a values-based decision-making process, we look at our values, and in addition to the financial metrics, we look at certain values and say, how does that expansion of a service line connect to our values? If it doesn't, maybe it's a non-starter. If it does, then let's go deeper analysis and decide if we can go forth or not. So that's just one example of a structural solution. But the individual solution is really important. How is it that we can ensure that our employees feel like coming to work is the best thing that they get to do, in addition to their family lives? How is it that we make sure that the patients that are served are getting the experience they need at that vulnerable moment in time? We believe that a satisfied employee leads to a more satisfied patient. and that the two are in a dialectical relationship. So we focus on both with an extreme focus, and we have a whole host of measures from patient satisfaction to employee satisfaction. Some of it is surveyed by ad nauseum, quite honestly, but we realize the importance of it because we want to get it right. And in a diverse community, as I mentioned earlier, from rural hospitals to urban cities, we're in Colorado with the 6th largest Hispanic population. There's no one-size-fit-all answer. It's something that we have to continue to work on and ensure that we're getting the messages and desires of those individuals and that they're being met when they come to our institutions.
No, I'm really glad you mentioned there's no one-size answer. I find a lot of times in healthcare, whether it's through conferences or going through different hospital systems and so forth, there's something called the technological imperative, which basically means that technology is a good and it should be implemented for better health. There's difficulties with that in a number of ways. One is who has access to that technology, and the second is just because technology exists doesn't necessarily mean that it'll be used in a beneficial versus a superfluous way. How do you ensure that the push in healthcare, especially the technological imperative in healthcare, is mitigated through a values-based kind of calculation?
Yeah, absolutely. I think it really starts with what's the ultimate goal. What's the ultimate goal of hospitals is to care for patients. And when you think of the technological imperative, technology can be a great benefit, but there are some risks. I mean, you highlighted it. Sometimes when technology is adopted by one institution, another institution feels compelled to adopt that same technology, irrespective of whether or not it's community need. That's just because there's a certain way in which there's a halo effect of technology. And patients think, wow, the most cutting edge Da Vinci machine or some other technology is happening over at that institution. So as you can imagine, because health is a business, another institution might seek to replicate that, sometimes at the expense of maybe putting that resource somewhere where there's a greater need. But I am a great proponent, and I think you are as well, of the benefits of technology in healthcare. We all know that with our artificial intelligence coming as rapidly as it is, that the opportunity to take large data sets and make decisions that improve patient care and reduce patient costs is right around the corner. There will be some winners and losers in the healthcare profession as a result of that. So I think it's an incumbent upon me as a person focused on values to ensure that I equip these employees with this new notion of technology, genetics, and other things that are coming down the path so that they can stay a part of the healthcare experience and that the great learnings that they've had over their years of experience continue to shape healthcare. But let's face it, at the end of the day, healthcare is both an art and a science. So it'll never be replaced only by the machine learning alone. There has to be some human because that human interaction leads to better health outcomes.
No, that I agree with you. You know, with regards to the art of medicine, how, given the technology and the advancement of just the complexity of healthcare, how are medical providers, how do they need to adapt to this changing environment? And how is Centura and how is your values integration able to ensure that type of adaptation?
Yeah, I think you hit on one of the most crucial issues in modern healthcare, the provider and the provider fatigue. Some call it compassion fatigue. I don't really care for that term because I feel like compassion is something that you should have a wealth of. But you understand, if a patient comes consistently, that same patient, and unfortunately we have frequent utilizers of the health system, and they don't adhere to the doctor's desires that are really desires for that patient's best interest, you could see a certain building frustration. So the modern healthcare system and these large systems where sometimes doctors didn't know they signed up to work in these big systems when they were in med school is a burgeoning frustration for physicians. So what we try to do, and quite honestly, right this Saturday, I'll be doing a retreat in front of 100 physicians, primary care physicians, and we'll be talking about issues such as resilience. We'll be talking about some of the frontline issues they encounter. As we move to the era of population health management, where we focus on chronic disease, the primary care physicians are on the front lines, and oftentimes we don't equip them with enough data, intel, or resources to address which often are social needs, issues of transportation, education, employment. Those things lead to better health, but they're way beyond the scope of a hospital or a primary care physician. And at times, these same physicians are afraid to ask the question because they don't have the resources in the background to meet that patient's needs.
No, look, I think that's great. One of the things I really enjoy when I went to your Future of Medicine conference is that you looked at medicine not strictly from physiological perspective, but you really understood like Maslow's hierarchy of needs of you need physiological health, you need safety and security, you need community involvement, you need a sense of identity and personal growth in order to achieve that type of self-actualization. A lot of times in healthcare, we kind of fall down to the bottom of that pyramid because it's easier. It's easier to look at humans as a machine that we can tinker with and fix, but we're not. There's a lot more of an emergence towards the personality, the psychology, the spirituality, the social aspects of what it takes to be human. Yeah. And I'm very happy to see that not only in the future of medicine, but Centura is even putting it into the present.
Yeah, I'm excited to hear you say that. I like to coin the phrase, it's no empty vessel. So there's a human being in front of us, and you can look at some of the physiological needs, but unless you adopt what I call whole person care, you will essentially fail. There's a spiritual component, and when we say spirituality, for some, it's going to be very tied to religion. To others, it's going to be a walk in the mountains or a walk in the park. But you need to meet that person at that deepest sense of self so that you can inspire the change, particularly when issues with chronic disease management or others where active consumers of healthcare products are so necessary.
So, Centura is a faith-based system.
Absolutely.
So I can understand why you might want to say spirituality is important. But how does being a faith-based system affect your view of spirituality, Centura's view of spirituality, and is it applicable to non-faith-based systems?
I think so. I mean, I'm an odd duck, I'll admit it. I have a law degree and a Master of Divinity, and people look at me like I'm either reformed or ruined, depending on what I did first. But in a faith-based institution, I think you have a tremendous opportunity to go a little deeper, go to that human connection. There's physicians that pray with the patient before surgery. We have chaplains in all our institutions that will meet patients during a birth or before a great procedure. And that's not uncommon, but what is common in our institution is people rally around the mission. We ask that everyone who comes to us, and Denver and Colorado is a great place to live, and yes, people from out of state want to come to our institution because they want to live in Colorado. But in our interviewing and our assessments of particularly leaders, we'll look to see a little deeper. Do you have a personal connection to our mission? Our mission is to carry on the healing ministry of Christ by caring for the ill and nurturing the health of the communities we serve. Clearly, you don't have to be a Christian to be in our organization, but can you have some kind of personal connection? Can you see that nurturing the health of the communities is something you're deeply passionate about? Can you see the story of Christ, even if you don't believe in Christ, as a story of a person that you can somehow have a connection with and embody notions of forgiveness or love? So we think it's important, and it's almost kind of ephemeral, if you will. It's something that's hard to put a kind of metric to, so you really can't measure it in that way, but you know when you see it. And we think there's a different feeling when you walk into our institutions because of our faith-based component.
So in certain faith-based organizations, when they do adult education and trying to look at medical ethics and how religion is important and so forth, I find a lot of times they focus on reproductive technology. And I think the reason why they focus on reproductive technology is because who doesn't want to have kids? Right? They stay very far away from end-of-life conversations and the medical ethics and the religious ethics tied to physician aid in dying or end-of-life care, because it's a subject that could be very quickly turned into talking past people with arguments as opposed to talking with people and having discussion. And it could be because the value premises are different depending on which type of religion you affiliate with. Do you find the same thing in terms of your public outreach and public education at Centura Health? Do people focus more on one aspect of healthcare than another?
Yeah, I mean, it's very regional, like most things. I mean, these are some very value-laden questions. So at the beginning of life, obviously based on different religious perspectives, there's a whole set of rules and guidelines. Then at the end of life, particularly given that there's been so many different movements on the state level to, as you said, have policies such as death with dignity or medical aid in dying. I think what I like to focus on is the end-of-life care in a way that meets that patient's needs. And we like to say you don't get a second chance of end-of-life care, and people come to you at this vulnerable moment. So it's really important that their desires, hopes, and aspirations drive the care, not the physician who feels like he can save that patient's life at great risk to that patient when the patient doesn't want it. So if that's the mantra, then we really need to double down on both advanced directives And the time to have a conversation about an advanced directive, what you want at the end of life, is not in the middle of a tough procedure. It's much earlier on. So we have conversations over time, particularly during National Advanced Directive Day. We're out in the communities educating folks about the importance of it, and then asking if they sign an advanced directive. And then actually review it 3 to 5 years later. Things might have changed. The person who you wanted to make an end-of-life decision, you may no longer want that same person to make an end-of-life decision. So very important. At its core, I think health is an individual decision, and their autonomy should be respected and enhanced as much as possible.
Now, I'm glad you mentioned advanced directives, and we've discussed this before. A lot of times people first get introduced to advanced directives when they're either in the hospital or when they're working with their lawyer on their financial will. Neither of those times might be the best, or the people that are discussing it with them may not be as equipped to understand what people's values are.
Yeah.
Have you been, through Centura Health, pushing a type of education in terms of how people should be looking at advanced directives and how people should be talking about advanced directives with their families and their end-of-life choices?
Absolutely. And I know it's a personal passion of yours, too. It's very important for us. And, people come, again, to faith-based institutions expecting a heightened level of respect at these vulnerable moments that can lead to the end of life. So, yes, it's something that we're focused on. The good news is that the importance of palliative care is starting to grow across the country. The National Institutes of Health and other institutions are really focused on it. And we're excited about the growing field. And really what it is, when you think of palliative care, it's not only at the end of life, it's any life-limiting illness. How do you get involved in a way that makes someone's life a little bit better, makes them understand what it means to lose a limb and to live with that, or to have a life-altering disease? And then clearly at the end of life, those moments where family members are around and you have an elder parent or grandparent, making the decision that is in line with that person's desires is so emotionally fraught. I went through it myself with my grandmother who died last year, and it was hard for us to let her go, but she wanted to go, and we had to let her go, and we had to let her go on her terms, and we finally got there as a family. But even someone like me who thinks about it a lot, it's harder when it's personal.
Of course.
Yeah.
As a JD and an MDiv, I'm safe to say that you're not a doctor.
No.
So what has your experience been being someone who's not a physician or not in the traditional route of healthcare education, being such a leader in the healthcare field?
Yeah. So I have a doctor of law, but not a medical doctor. I did tell my wife that one day when I go back to get a medical degree, and she got really angry at me and said, "Yeah, but
They always do.
Give up on the school." But I do think, it's an interesting point because this notion of who should lead in healthcare. And clearly physicians are leaders in healthcare. They're seeing the patients. I think nurses are leaders in healthcare as well. They see patients. I was happy to see that for the first time in our history, we have a surgeon general who's not a surgeon, who's not a doctor, but a nurse. Fascinating. And then when you think of who should lead in healthcare, particularly in these large health systems, there's a great debate. Should it be a physician-led entity? Should it be an entity led by a lawyer or a bureaucrat? I think the title and the training around the technical expertise is less important, but the importance of having a person in that role who's driven by a certain values, a certain understanding of the importance of healthcare, and a certain view of healthcare maybe as a right is going to be more important. So I think that individual shaping and training and ensuring that there's a cultural fit. So to bring someone into an inner city as leader of a hospital system who hasn't spent much time in an inner city and the challenges that encounters, to me doesn't make the most sense. Similarly, to drop somebody in a rural hospital like Pueblo or Garden City. In Garden City, they kill close to 25,000 cattle a day. I would argue that somebody in that community should know farming, should know some of the rural communities, should know what's important to its constituents in a certain sense in order to be a leader. So I think that's the important thing.
Do you think that given how tied healthcare is today to political policies and legal regulation, anywhere from malpractice to how we're going to pay for healthcare, that lawyers and people with legal training have a unique role to play in healthcare?
Yeah. Yes and no.
I'm not trying to
well, yes
push
and no.
that.
No, yes and no. And yes in one respect because it's complicated, and legal training teaches you to clarify ideas and separate issues and have detailed, nuanced dialogue. In another sense, and it really depends on your training, a good quote is lawyers hope for the best but plan for the worst. So you'll find some kind of lawyers who are very risk adverse. And healthcare obviously is a very important industry with the patient at the center, but we'll need folks who are willing to take a chance. Other industries have a term, fail fast. I can tell you healthcare doesn't like to fail at all. The experiments that we do in research, the bench to bedside, we don't always see that same type of ethos in healthcare. And it's one thing to know the science well to get to the bedside. It's another thing to have that science drive the delivery of care. So a lawyer could be a good person to lead an organization, a physician could. I think it goes back to that person, that willingness to take a chance, to deeply understand that community, to embrace technology, and to reduce costs with the patient at the center of care.
Well, James, I want to thank you for coming in today.
Thank you.
It was both very educational and I think an important conversation for us to have. And it's great to see someone who not only can talk the talk, but is really implementing these values for community health improvement all over Colorado and Kansas.
Yes.
We have reached the part of our show where I recommend a book that can provide greater insight into the topic we've been discussing. This week, I recommend An American Sickness: How Healthcare Became Big Business and How You Can Take It Back by Elizabeth Rosenthal. A doctor who became a journalist, Rosenthal brings the best of both by diagnosing and suggesting possible solutions to the problems facing the American healthcare system. She uses a physician's method of examining the chief complaint, looking at various symptoms, and understanding the history of its illness to come to its underlying cause. She is also able to support her diagnosis and suggestions for fixing healthcare through journalistic excellence and integrity. An American Sickness is a worthwhile read for anyone, expert and layperson alike, who wants to get a broad overview of the challenges of the U.S. healthcare system and what we can do individually and as a collective to start to fix it. We will close each show with a maxim that we hope will provide a simple takeaway that keeps you mindful of the ideas discussed. This week, the maxim is, in pursuing your and your neighbor's health, there's more at stake than simply one's wealth. We hope that with this show, you have come a little closer to achieving the good life.